Adrenergic drugs are medications that either stimulate or inhibit the actions of the adrenergic receptors, which are part of the sympathetic nervous system. Sympathomimetics, or adrenergic agonists, mimic the action of the sympathetic nervous system by activating adrenergic receptors. These drugs are further classified based on the specific receptors they target. For example, phenylephrine stimulates A1 receptors, leading to vasoconstriction and increased blood pressure. Clonidine, on the other hand, stimulates A2 receptors in the central nervous system, decreasing sympathetic outflow and reducing blood pressure. Dobutamine selectively stimulates B1 receptors in the heart, increasing heart rate and myocardial contractility. Albuterol targets B2 receptors in the lungs, causing bronchodilation and relief from bronchospasm. Epinephrine is a mixed alpha and beta adrenergic agonist, causing vasoconstriction, increased heart rate, and bronchodilation. Sympatholytics, or adrenergic antagonists, inhibit the actions of the sympathetic nervous system by blocking adrenergic receptors. These drugs are also classified based on the receptors they block. Prazosin, for instance, blocks A1 receptors, leading to vasodilation and decreased blood pressure. Non-selective beta blockers like propranolol block both B1 and B2 receptors, resulting in decreased heart rate, reduced cardiac output, and bronchoconstriction. Selective B1 blockers, such as metoprolol, specifically target B1 receptors in the heart, reducing heart rate and blood pressure without significantly affecting B2 receptors in the lungs. Labetalol is a mixed alpha and beta adrenergic antagonist, causing vasodilation and a decrease in heart rate and blood pressure. Indirect-acting adrenergic agonists increase the release or inhibit the reuptake of norepinephrine and other neurotransmitters. Amphetamine is a prime example of this class. It increases the release of norepinephrine and dopamine from nerve terminals, enhancing their effects on adrenergic receptors. This results in heightened alertness, increased heart rate, and elevated blood pressure. These drugs are often used in the treatment of conditions like attention deficit hyperactivity disorder, ADHD, and narcolepsy. By boosting the levels of neurotransmitters, indirect-acting adrenergic agonists can significantly impact both the central and peripheral nervous systems. Indirect-acting adrenergic antagonists reduce the release or increase the degradation of norepinephrine and other neurotransmitters. Reserpine is a notable example. It inhibits the storage of norepinephrine in synaptic vesicles, leading to a depletion of norepinephrine and reduced sympathetic activity. This results in lowered blood pressure and a calming effect on the nervous system. These drugs are often used in the treatment of hypertension and certain psychiatric disorders. By decreasing the levels of neurotransmitters, indirect-acting adrenergic antagonists can help manage conditions that involve excessive sympathetic nervous system activity. Understanding adrenergic drugs and their classifications is crucial for their therapeutic applications. Sympathomimetics, or adrenergic agonists, activate adrenergic receptors to mimic the sympathetic nervous system, while sympatholytics, or adrenergic antagonists, block these receptors to inhibit sympathetic activity. Indirect-acting adrenergic agonists and antagonists either increase the release or inhibit the storage of neurotransmitters like norepinephrine. These drugs play a vital role in treating a variety of conditions, including hypertension, heart failure, asthma, ADHD, and psychiatric disorders. By targeting specific adrenergic receptors, these medications can provide tailored treatments to manage and alleviate symptoms effectively.